Some dentistry is not simple, but we can make the process simple and we can make the process much lower stress for patients. The implant is a post that goes into the patient's jawbone, and the body heals to it in such a way that it almost becomes part of the bone, as opposed to it's something separate. And then we have a foundation that we can do multiple things with. If you're missing one tooth, we can attach a tooth right onto the top of that implant. If you have a loose-fitting denture, we can put an attachment on it so that the denture can snap on and it won't move anymore. Mini implants and traditional dental implants are the same things. They are titanium that is placed into a patient's bone to replace the supporting structure of teeth. So in one situation, it may require a traditional implant to replace those missing teeth, and in some very specialized situations, it may just require a mini implant to achieve our goals. The accuracy that we're able to perform these procedures has improved exponentially over the last 15 years with the computer technology that we're using to place implants exactly where we plan them. It used to be we didn't know. What we commonly hear from patients is, my dentist said we didn't have enough bone. I don't have enough bone. That can be true, but very often anymore it's not true. Planning is everything. We know with three-dimensional scanning how much bone the patients have and the quality of the bone that the patient has. We know a lot of the unknowns prior to the treatment, and we're able to prescribe a treatment that foresees the obstacles. And this takes time, but it's time well spent because it saves the patient time in the office and time in healing. In the past, you'd have to wait 6 months after having the tooth taken out to then have the implant placed, and then wait another 3 to 6 months before you have a tooth in that. Now we're able very often to give a patient a tooth the day they come in, and that's a big change, a big shift in dentistry. The day you need the implant is the day ideally you should get the implant. In our practice, now that it's become so routine, we know that we will have a greater success if we place the implant either at the time that we take the tooth out or shortly thereafter than we will 2 years from now. And for the patient, it also prevents other consequences of leaving a tooth out for any period of time. We don't want the teeth to shift. We don't want bite changes, and we don't want to lose bone. There are people that say, after years and years and years of not having teeth, I can't believe I waited this long. Yeah. I don't know what I was thinking. It's never too late to find out. Likely, we'll be able to help you. It's very likely.